Hey everybody, welcome to the Homebirth of 536 week update. This is the video I said I would make after my home visit with one of my midwives, and I had that earlier this morning, and I thought I'd just give a quick little recap of what we discussed. So there was nothing really major. Basically we went over what I had hoped for this birth and what my birth plan would be. I used to not believe in birth plans at all. I used to think they were a bit of a way to focus on things that really didn't matter in birth, especially in many situations. With my midwives, a lot of the stuff that you would see online to include in a birth plan really was not relevant at all. So I didn't use to put much stock in them. And then once I began working as a doula and saw more of what happens in hospitals at hospital births, I really started to have a better appreciation of why people do them. So I did my birth plan for this birth, and I just thought I'd review that with you guys. So for labor itself, I have a couple of things that I would prefer. I did my Group B strep swab this morning. For those of you who don't know, Group B strep is a bacteria that is common in your digestive tract, and sometimes, unfortunately, you get colonized with it in your vagina, and so as the baby comes out of the birth canal, you're at risk for exposing the baby to Group B strep, and it can cause all sorts of problems with the baby and its breathing, and it can get infections. So in the hospital, the standard of care is that you automatically get IV and antibiotics every 4 hours. With the midwives, you have the option of not testing at all, or you can test and then decide not to do anything, or you can test and get the antibiotics and just receive them at home if you're having a home birth. So we're going with the latter. I don't mind having an IV in labor. I had one with my last labor experience, and I'd much rather know that my baby, the risk was less with having Group B strep. So that's something that I feel comfortable with. I know there's lots of people and lots of reasons not to treat Group B strep, especially because it is such a normal flora in our bodies, but that's my comfort level. I also discussed with my midwife that I would prefer minimal vaginal exams. I really have no problem getting vaginal exams. I've actually found them reassuring at certain points during my labor to know exactly how dilated I am, but I kind of feel if a lot of this birth for me, what I would like it to be is learning to trust my body again. And so part of that is just going with what I seem to be doing and seeing what works, and trusting that, you know, if I'm acting like I'm transitioning, then yeah, you're transitioning. And if I'm acting like I need to push, then yeah, you probably need to push. So it's more about trusting that whole process. And, you know, it doesn't hurt not to have fingers out there. For the birth itself, I rent birth pools. So I'm hoping to have a water birth this time. With my first, I was in the water from 5 to 10 centimeters, and I loved it for the pain relief. But once I got to 10 centimeters, I got squirrely and I just had to get out of the tub. So this time, especially because my last experience with pushing was that I had a baby in less than 11 minutes, I would like to be encouraged to stay in the tub. So we talked about that. It's not something that I'm totally set on that I have to do, but I would prefer it. We also I would like to catch the baby this time, which is kind of the fun discussion we had with my husband, because my midwife asked, oh, well, would you like to catch the baby? And Mark was like, sure, I'll go ahead and do that. And I was a little more, no, I kind of want to catch the baby. So we'll see how it works out. I'm not tied to anything. I just thought it would be something fun to do. We didn't do anything hands-on like that for our first two boys, which included neither of us cut the cord. The midwives always did. So we want to do something knowing that this is our last baby that we're planning on having. If possible, we would like our two younger sons to be there. So our oldest is 4.5 and our youngest is 2, almost 2.5. So we would like them to be here at the birth, and my sister is going to come and watch them. So if things prove to be too intense for them, or they're too distracting for me, or should we need to go to the hospital, my sister will be able to just usher them out. But otherwise, I'd really like them there when their little brother or sister is born. By way of announcing the gender, that's something else that we really want to do this time, because we haven't found out what the baby's gender is. I don't know if it'll be my husband or if it'll be me, but one of us will announce what our baby is. By way of third stage management and cord cutting, I think I would like to cut the cord. My oldest son says he would like to cut it, but I'm not sure if when push comes to shove he'll actually be into doing it. So we'll leave that option open. The other thing I would really like to do this time is not cut the cord until the placenta is born. Now, it's one of my good friends said, you know, the reason she did it was because she just wanted to do it. Like, you know, there's no reason not to, so why not? I have this really amazing picture, and I'll see if I can find a link to post it. But another doula who is out of New York, I do believe, took this amazing picture of a baby being lifted up out of the water during a water birth, with the cord still attached and the placenta floating in a bowl, and it's absolutely beautiful. And it really just resonated with me when I first saw that picture. So I don't really want to recreate the moment. I don't necessarily feel like I need a picture of that myself, but I do really want to just leave things be and have that be something different with this birth. And once again, for me, that's, you know, another trusting and honoring thing, that trusting that my body will work to have my placenta out in a timely manner, and it won't hinder things. So, you know, it's also one of those things where I'm not tied to it. If something's happening with the baby or with me and we need to cut the cord, then we'll cut the cord. But for the meantime, that's what we'd like to try and do. We are going to encapsulate our placenta. Because of all my struggles with sadness and prenatal depression this time, I'm definitely willing to throw anything I can at preventing a postpartum depression. So I think encapsulation would be the best thing for us. I've also had a previous breast surgery when I was 22, and I've required motilium to make breast milk, at least in the beginning, for both my other children. So I'm hoping that the encapsulation and the extra hormones in the placenta will help with milk production. And then for care of the baby, the two big things, we're not going to give here in Canada, at least in our province, they do let you have the option of giving the vitamin K or not. That's an injection to help with blood clotting after birth, and they also allow you to opt in or out of having the erythromycin eye ointment. So the erythromycin eye ointment was because to prevent the babies from being exposed to any sexually transmitted infections in the vaginal canal with birth. I'm fairly comfortable with the fact that I do not have any STIs. I'm fairly comfortable believing my husband when he tells me there's no need for me to get that for our child, you know. So we're not going to get the eye ointment. We are going to get the vitamin K shot. Personally, I don't feel strongly that it's harmful, even though the numbers on the number of children who need it are really low, and considering we give it to every baby, it's probably a little more conservative than we need to be, but I'm comfortable with it, so we're going to go ahead and do that. The other thing that's really important for me is that the baby be checked for a tongue tie. My second had a pretty decent tongue tie, and it wasn't caught until he was 3 days old. So of course by then I'd had troubles with his latch, and in fact he was a lazy latcher from the get-go. So Now I just want to make sure that this next child, if it's tongue-tied, that it's caught right at the beginning and that it can be dealt with, so I don't have to deal with any nursing problems down the road. Once again, that's another one of those things that people have very strong feelings about. There's lots of people who are able to nurse and nurse well, even if their child has a tongue tie. With my supply issues, it's not a good combination for us. If I can't transfer the milk to the baby effectively, that pretty much kills my supply, and then I'm back on Motilium, so I don't want to do that. Beyond that, I don't really have much to tell you. I am going to make another video in the next week or so of all our home birth supplies and the water birth setup. Really, I'm just in a total denial that the possibility of this baby coming anytime after next week is close. I'm measuring spot on. I'm measuring 35, 36 weeks. I'll be technically 36 weeks on Wednesday. My blood pressure, I've been tracking it myself. It's been in the 118 to 120 on like high 70s to low 80s range. The midwife did not check it today because I gave her my numbers, and I'll just check it a few more times. I'm sure next week the midwife that I see in the clinic will check it though, because that's the kind of person she is. But yeah, I'm trying not to worry about it. And then along with that, the last 2 days I've had a little bit of swelling in my hands, and it's not really like, you can't even say like there's swelling, like they don't look, I have big man hands, but they don't look swollen. It's more that I feel like my joints have some extra fluid in them, and I feel that in my toes, and I feel it in my hands. Currently my weight, I'm not gaining crazy amounts of weight, but I'm currently at the weight that I had my first son at.